Welcome to Stuck in My Mind podcast, the show where we dive into the mind of a regular guy on his road to self-discovery. You'll hear everyday people just like you share the latest topics, personal stories, and things they've learned along the way. And now, please welcome your host, Wise.
And welcome to another episode. I am your host, WIZE. I have a very special guest. He's the executive director of addiction medicine. Welcome to the show, Dr. Joseph Volpicelli. Hey, Doc.
Hi, good to see you.
How you doing today?
Very good, very good.
I'm glad you're here. I actually I lost a brother to opioid overdose a few years back, and so once your assistant reached out to me, I was like, okay, I would love to have you on because this is something that's personal to me, and so welcome to the show.
Well, thank you. Yeah, hopefully we can help some people today.
Definitely. So, Doc, let everybody tell everybody about yourself.
Sure. Yeah, I started being interested in addiction treatment when I was in medical school, and I treated a patient who was a Vietnam vet. And when he returned from Vietnam, he had been using opiates while he was in Vietnam, but when he came back to the United States, he started using alcohol. And so I was wondering what the interaction was between alcohol and opiates. And at the time, I was also getting my PhD and doing some research. And I found that both alcohol and opiates work by stimulating the opiate receptor system in your body. And then I could block alcohol drinking. I could reduce alcohol drinking by blocking the receptors with naltrexone, which is an opiate receptor blocker. And from the research, we did trials, and we found that it worked in a VA sample. And we got the medicine approved by the FDA. And so it's a really effective medicine to treat people with alcohol use disorder or opiate addiction. But what we found was that the medicine, while it was helpful, wasn't the whole story, that the medicine really needed to be combined with psychosocial support to help people engage in treatment, stay in treatment, and fully recover. So I developed a psychosocial program that was designed to enhance patient engagement, and wrote a book about it and did my best to train clinicians to use it. And what we found was in our research studies, it was really great to help people stay in treatment and to collect data. But outside of our treatment research studies, we found that it wasn't really being applied clinically. And so one of the things that's been very disappointing for me, and as you point out, the situation with your brother, fortunately, 100,000 people died from overdose deaths last year. If you're under 50 years of age, it's the number one cause of death. It's more common than cancer, heart disease. It's a really significant problem in the United States, and we're just not doing a very good job of treating it. And so I was frustrated when we found in our research studies we could get people better, but those procedures that we were using in research weren't being applied clinically. So in 2008, I left the University of Pennsylvania, where I was a tenured professor, and started the Volpicelli Center and the Institute of Addiction Medicine as a way to help set up a model program to help people who have addiction problems. And the Institute is a nonprofit organization which is designed to help do research and help educate people about effective treatments for addiction.
Yes, because for many years, people didn't treat addiction like what it is now. Like back then, people thought, oh, they looked down at people who were addicted to opioids or addicted to whatever drugs or whatever, and they, instead of dealing with the issue, what they did was put people behind bars.
Yes.
Instead of really taking the time to find out why are these people addicted and what is going on. Their answer was lock them up.
Yeah, exactly.
And instead of actually helping these people seek the treatment that they needed, but now now it's getting treated more like the condition that it is, and not as something that these people need to get locked up for.
Yeah, exactly. Treating addiction is a lot more than a slogan that you can wear on a hat. It's more than just telling people just say no or lock them up or lock up the people who sell the drugs. That it's a condition that, as you understand it, as opposed to judging it, can be very effective to help people get better. But you're right. If you judge people, you're not going to help people recover.
Yeah, and that was something with that was something a problem with my brother. It was we would get him the help that he needed, and he would be fine for a while, and then he'll relapse and get back into it. And this last time, it was he just never recovered. It was something that they found him in the bathroom with it on next to him. So it, to me, it's just like had they, I don't know. I can't say maybe. Who knows what would happen if he would have got the proper treatment that he needed. It, who it's just to me, it's just we need to do more because there's like you said, thousands of people die yearly of this, and and some of these and a lot of these people get addicted nowadays through prescription medication with what they prescribe to these people, and these pharmaceutical companies need to be held accountable because
Yeah, no, exactly right. And I've been around long enough where when I first entered medicine, there was a push to get doctors to write for more pain medicines. They used to call pain the fifth cardinal symptom. And they pointed out that when people got adequate pain medicine, that they were able to function better. But also around that time, some of the pharmaceutical companies were pushing us to write for a form of morphine that you could take twice a day. Normally, morphine you give more than twice a day, but this was a form that was formulated so that it was supposed to be longer acting. And what happened was that people would complain of pain between doses. So the medicine would actually wear off after 8 hours instead of 12 hours. And rather than just increase the frequency that we would give the medicine, the drug reps suggested to us that no, 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 if a person's still getting pain, they just need a higher dose of the medicine. So doctors would go around giving people higher doses. And then after a while, the patients would look like they were addicted. They would be running out of their prescriptions too soon. They would be doctor shopping, and we would go back and say, this looks an awful lot like addiction to us. But they had a term for it. They called it pseudo addiction. It's not really addiction. It's pseudo addiction, and you're just not using the medicine correctly. And later we learned that we were not helping our patients at all. We were harming them. Now the pendulum seems to be swinging back, and some doctors are now so against using any opiates to treat pain that people who are suffering are not getting the pain relief that they need. So we have to really look at it from a very nuanced way, from a balanced way, so that we use pain medicines appropriately, but we help people not get addicted to them.
all right. I see you're a Sixers fan.
I am, yes.
I'm a Knicks
And an
fan,
Eagles
so
fan, and
and I'm a Giants fan.
oh my. Well, hopefully I didn't run into you back in the day at the vet.
No, no.
Fans would come in and
I live in the Pocono Mountains here in Pennsylvania. So
then we have to switch you over to the Philly sports then.
no, it's not gonna happen. It's not gonna happen. Back there, that's the original Yankee State. That's the original Yankee Stadium right there. So
83 Sixers.
yeah, listen, I'm a big sports fan. I love sports, and
Oh, so do I.
yeah,
So do I.
but it's just for me. Like I said, this is something personal again because of my brother, and now, of course, now with because it's been crazy the last few years of how many people have died of opioid abuse and overdosing and all that. And now, of course, you have all these politicians swearing like, "Oh, we're gonna battle this and get rid of it and all that." And once I guess once they got elected, it kind of like died down. Like nobody's is it was back into the back. Like, okay, yeah, we'll address it when it happens. The numbers start spiking again or something.
Yeah, it's important to really keep it in sharp focus because it is number one cause of death for people under 50. It's a really significant problem, and unfortunately, your story is very common. I don't think anyone that I know has not been touched personally uh, without someone who's overdosed. So it's a really significant problem, and my frustration is we could do a better job, and there are effective treatments, but part of the problem is that if you look in the treatment community, even so, when people actually do find their way into treatment, they still don't get optimal treatment. That some treatment programs just offer counseling, other programs just offer medicines like buprenorphine or Vivitrol, and people don't get the optimal care, which is when you combine the psychosocial with the right medicine. And when you do that, you really get good, successful outcomes. And that's what we found in our center that we set up. That when we combine the two approaches and deliver quality care, that people can recover. So not always a straight course. There are some people who do well for a while and they slip and relapse. And of course, if you slip from opiates, you lose that tolerance to opiates. So a dose that you used to use to get high might be too strong of a dose now. Then the other thing that's really a problem over the last couple of years is fentanyl. Fentanyl is a very potent opioid. It's like 100 times more potent than morphine. And people are by their heroin, but it actually contains fentanyl in it, and they'll overdose and die. And one of the problems that we've seen is people who aren't even addicted to opiates wind up dying from fentanyl overdose because people will buy their Xanax on the street, but instead of containing Xanax, it contains fentanyl. And so people are trying to be more careful to test any drugs that they buy on the street to make sure it doesn't have fentanyl in it. But it's in virtually every street drug now. So it's a very significant problem. We could do a much better job of treating folks.
Yeah, it is. Like you said, it's a very serious problem. And I have a older brother, another one who that's what they were using to help him to wean him
Mhm.
off of heroin, and it got to a point where he became really addicted to it, and thank God he's been able to they've been able to wean him off of it and help him put him on something else
Mhm.
besides fentanyl, and he's doing much better, thank
That's
God.
great.
So, but again, this is something that hits people close to home, and
Yes.
so people just don't understand that. Like this is again, like I said, for many years it was people were looked down upon. They didn't get the help that they properly needed, and so for you to start your center and do what you're doing is great because again we is not the answer is not locking these people up. The
No.
answer is trying to help them overcome this and become functioning people again in society.
Yeah, and I can't tell you how many stories I have of people who've been involved with the criminal justice system and they're on probation or other programs, and we've been able to help turn their lives around. So for me, working with people with addictions is a very rewarding job. I really love it. I learn an awful lot from my patients, and it's great to see as they recover how it improves their relationships with other people, how they have purpose in life, they have something to live for. And some days my waiting room is filled with people who are in recovery, and they bring their families with them, and so people can get better, but we have to have the will to do it, and it really involves combining the psychosocial support with the right medicine. Now, one of the things actually that I'm doing research on now that's kind of interesting is that while I know how important it is to get psychosocial support, particularly during the pandemic, it was really difficult to get people the right psychosocial support, particularly in underserved areas, rural areas. There weren't any counselors out there. And so, one of the things that's really exciting and hot in medicine now is the idea of digital therapeutics. And so it's really interesting because it acts like a counselor. It's a program that you access, and you can access it anytime, anywhere that you have an internet connection. And the program helps teach you skills to learn to cope with craving, to deal with anxiety, how to relate to people. And so we're doing research now where we're combining the digital therapeutic with a medicine to treat people with opiate use disorder. And we'll see how effective it is. And so that's one of the things I'm doing research on now.
Well, you would figure that would be a route you would have to go to with, especially with the way everybody is consuming digital content. It's and nowadays not everybody wants to go into a doctor's office. A lot of them prefer
Exactly.
this kind of contact where you meet each other, we see each other through video or whatever, and so it makes sense that you would evolve to something like that because, like I said, right now digital content is king.
Yes.
It's everyone is using it. Every field is a part. Is now a part of whatever your business is. So you have to evolve with the time, and but you can tell that this is something really personal to you. This is you can tell that
Yes.
you care about your patients. You're a doctor who wants to see your patients do well and not come back to see you.
Yes. That's the goal. Yeah. Exactly. I mean, too often people will go away to like an inpatient program and spend $50,000, $60,000 for the program, and the program has to offer is like 5-star chefs and petting the dolphins, and that's fine, but that's not necessarily going to get people better. When they leave, then they go back to the old environment, and pretty soon they're using drugs again. So we have approaches that work, and many people who are in treatment aren't getting the full blast that you need. I think about a third of the people who have opiate use disorder who are in treatment even get one of the medicines, and there's several medicines that are available to help people. So they're not even being offered the medicines, and then you have doctors who are just writing for the medicines, and they think that that's what's going to help people, but a lot of times the patients take the medicines for a while, then they stop taking the medicines so that they can get high again, and they still haven't turned their lives around. But when you combine the two, that's when people really get better. And if we can't get counselors to do it, maybe these digital therapeutics can help provide that support. And certainly, friends, families can help. We need the whole community to help. But you're right that we can't look in a judgmental way at people who have addictions. The stigma keeps people from even coming in for treatment, and we can't do that. It's a medical condition like other medical conditions, and they're effective treatments. And when people get on the right treatment and stay on it, they can get better. But in this country right now, we're just not doing a very good job of it, and we can do better.
we're not doing we're not doing too much too too many things in this country well.
Yeah. Well, yeah. I mean, some of the issues that we're dealing with in the addiction field, where there's silos of care, people not talking to each other, people believing their own set of data. We have all those things in the addiction field. And if we could learn to figure out a solution there, maybe we can apply it to other problems we have in this country.
Yeah, if we could just get together and just realize that yes, we're all different, but at the bottom of it all, I feel like we all want the same thing in life.
Yeah, exactly. I see all different types of people, gay, straight, black, white, every nationality, every age, and people come down to the same thing. They want to be able to make a living and have a relationship and some purpose. And when that's the important thing for people. That's their goal. And when you address those issues, then using drugs or alcohol becomes a lot less important. But when those needs are not met, that's when people are at risk for using drugs and relapsing. And that's what we find in our treatment, that it's not enough just to give us a clean urine that is drug free. That's not necessarily recovery. It's when they come in with their significant others, when they come in with job promotions, things like that. That's when I know people are on the road to recovery. That's for us what treatment is all about. And you can't do it with just the medicine, and you can't do it a lot of times without the medicine, particularly early in treatment when people are struggling so much.
No, it takes a combination of both. It's like again, I'm to me, it's under the right supervision and under the right care, it can be done, and you're showing that. And so again, I know how I would feel to be able to see your patients get the promotions and come to you and show you that they're able to turn their life around. And so I commend you, man. That's great. Believe me, I've known that's a great feeling to be able to
Yeah.
help people and find your purpose and know that this is what I'm here to do, is to help these people turn their lives around.
Yeah. And, we can all have some purpose here that even for those of us who've lost people to addictions, we can do something to help teach other people that it doesn't have to turn out that way, that there are options out there. And you just have to be really determined to find programs that offer the integrated care. And when you do that, you're going to get a better result. But we have to let people know it's not something to blame people for. It's not something to stigmatize. That people are struggling, and it's not that they have any defect in their character that causes the addiction. It's they could play sports and get prescribed opiates for pain, and pretty soon when the opiates wear off, they start feeling lousy, and so then they redose on opiates, and then the opiate use creates more opiate use, and then they find that the doctors won't write for the pills anymore,
Yep.
so they go
Yeah.
down to the corner and they
Yeah.
buy something on the street, and before they know it, they're hooked.
Yeah.
And that could be anyone. I have folks in urban in Philadelphia. I have folks in the suburbs, and it affects all
It,
walks of life.
it does. It affects, like you said, the kid down the street in the hood, or the kid down the street in the suburbs. It attacks everyone the same, and it's a big issue. It's not just an issue that's happening in the urban areas. Now it's happening in rural areas where people are getting addicted to this and overdosing and dying. So it's not uh, a black or white thing. It's a society issue. It's just something that it's affecting everyone.
Yeah, I mean, if there's one issue that can unite everyone, this would be it, because it affects all of us. And the treatment is there. We just need to have the will to provide it for people. We need to make sure insurance companies are willing to pay for quality treatment, that it's the insurances are divided into those who give medical care versus those who give behavioral care.
Yeah,
And there's just so many silos that make it difficult to get the right kind of treatement.
yeah. Don't get me started on the insurance company.
Yeah, you're right. I don't want to get started on that either.
Yeah, it's more. We already know they're more for profit than to care for the patient. So
They have their issues. That's for
yes, they
sure.
do.
My
They do.
stepson works for an insurance company, so I have to watch what I say. But they'll tell me their profit margins are very slender. But their goal for an insurance company is to make sure they bring in more money than they pay out.
Yes.
The goal for insurance company is not to give quality health care. So we have it backwards. We keep thinking the insurance company should make decisions whether you should get this medicine or that medicine, this care or that care. But their motive is to make sure
Profit. Yeah.
that they make a profit at the end of the day. It's basically they're gambling, and they're gambling that you're not going to need the health care that you're paying for, and then
Yeah.
they make a profit. And sometimes they do that by making it difficult for you to get the right kind of health care you need. So their goal is not necessarily to make you healthy. Their goal is to win the bet, if you will.
Yeah. Oh, Doc, this has been great. I greatly appreciate you coming on the show.
No, thank you.
This has been some some great stuff. Like I said, it's something personal and dear to me. And so let everybody know. Now it's time where you let everybody know where they can
Sure.
find you at, where's the center at, and everything.
Yeah. So our center's in outside of Philadelphia and Plymouth meeting, but you can come to our website, volpicellicenter.com. Or if you're interested in some of the research we're doing, you can go to the instituteaddictionmedicine.org. And if you want to hit me up, you can see me on LinkedIn. I'm at Joseph Volpicelli. And if you're interested in some of that new stuff with the digital therapeutics, we're doing a study with this program called Medea. You can go to us.modea.pro. So if you want to learn about the digital therapeutics, but there's new interesting ways to help treat folks. We can do it. We just need to have the will to do it and give people the consideration that they deserve the help that's out there, and not judge them, not be stigmatized, but to really encourage people to get help and keep doing what you're doing to let people know that there's effective treatments out there.
And that's once I got behind the mic and found that this is what I was passionate about, this is what I love to do. It was a no brainer for me to come on here and talk to people like yourself and other people, because it was when I started my podcast, there was nothing but negative stuff in the news. It was about
Mm,
the time the George Floyd situation happened.
yes,
We had politics going on where it was red and blue and all
yes,
this nonsense. And so I felt that I didn't want to put out content that fed into that. I
that's
wanted to put something out different, put something out where was focused on building and helping people back up and not tearing them down. And so to be able to do my podcast and have guests on like yourself where we can help people out. If someone, who knows, someone's listening to this episode that's suffering from opioid addiction, might hear this and be like, "Oh man, there is some place I can go to get some help," or it or they can look at it and be like, "Man, I'm not alone. There's other people out there that have suffered through this."
yeah,
And so I just continue to do what I do because I love it. This is what I want to do. This is my purpose, is to
that's
help.
great.
And so to have guests on again like yourself come on and talk about hot button topics and stuff like that is important to me.
Yeah, that's great. And people get stuck and get discouraged, and sometimes particularly if you lost a family member to it, you can get angry and upset and blame this person or that person, and it usually doesn't do any good, doesn't bring the person back, and just creates more difficulty for the next person to get help. But by staying optimistic, by looking at the data, by making it easy for people to get help as opposed to making it easy for them to stay in their addiction, that's the strategy to help get people to move forward. And yeah, I think what you're doing is a good example that you don't have to be stuck, that you can move forward.
Hence the name of my podcast stuck in my mind, which for me, for personally, I was stuck in my mind for many years. And so to be able to help people get out of it, get unstuck, and be
Yes.
able to help people with whatever issues that they have is it's to me it it's a great feeling to me. I wish people could feel the joy and the energy I feel when I'm able to put out good content like this, where I know that someone's going to hear this and that it's going to help them out.
It's great. You didn't let it beat you.
It's crazy because all right, because I was it's like through my 30s I went through a lot of tragedy. I lost my wife to a car accident. I had reunited with my dad after 25 years, only to lose him Father's Day weekend.
Oh my.
I lost an uncle and a brother 3 months apart. One was a crazy weird accident, and the other one He suffered from hepatitis B and HIV and passed away. And then I lost an aunt who was very important to me to cancer. And then my other brother, who had just probably turned 40 years old when he lost his battle with opioids. So, and believe me, I was angry. I was angry. I was self-destructive. I was headed down the wrong path, and I was able to turn my life around. I got remarried. I moved up to the mountains in Poconos, and I have a good career. I have a podcast that's thriving. So I'm blessed right now to be able to do this and be able to spread these messages out there.
And you're a good example, and it's a model for other people to know that they can turn things around.
But Doc, this has been great. I appreciate you coming through, man. It's anytime you want to come through, I would love to have you come and talk about anything you have.
Great, thanks. I'd be happy to come back.
Programs you have, any programs you have, or anything new, or a book, or anything you want to come out and promote. Just have your assistant send me a message, and we'll definitely set it up.
Well, when the Eagles are playing the Giants, we'll have to get together.
I'm surrounded by the Eagles fans. Believe me, I'm surrounded by Eagles fans, especially at work. I have nothing but Eagles fans, and they have high hopes this year.
We do very much.
Everybody in the NFC East has high hopes this year. Everybody's done some major changes. It's funny because I'm actually starting a podcast with 4 other gentlemen. 2 of them are Eagles fans. One is a Dallas Cowboy fan.
Oh no!
And the other one is a
we Washington. Can agree that Dallas sucks. Right?
Oh yeah, we could. That's something we can definitely agree on. Is that Dallas sucks. But all right. But thanks, Doc. Hold on one second. Don't leave just yet. I'm gonna do shout outs, and you can talk a little bit off camera. All right. So now it is time for shout outs. Big shout out to my Real Wise fam, Bobby J, Brandy J, love you guys. Big shout out to the boss lady, Fina, love you, babe. Big shout out to Dr. Volpicelli for coming through and sharing, even though he's an Eagles fan, but we'll let that slide. And as always, a big shout out to all the essential workers out there. God bless y'all. Be safe. You know how your boy Wise does it. Peace out.
Thanks for listening. Listen on iTunes, Podbean, Spotify, and TuneIn. Find us on social media on Twitter at @wise_b_blunt, Instagram at @wise_b_blunt, and a Facebook fan page, www.facebook/wise76. Check back soon for new episodes. Until next time, peace out.